So hey there ladies, I am so excited about today's video because I have partnered up with the menopause specialist, Midi Health. I have been very vocal on my channel about all things getting older. I'm now 53. I've had a hysterectomy. I'm in full-blown menopause and have been for, gosh, a year and a half now. And I have shared my journey and my struggles with you all on my channel. But in today's video, I'm going to answer your questions that you sent directly to me about menopause, perimenopause, weight gain, bloating, insomnia, just everything. I reached out to you all on my YouTube community page and on Instagram and asked you to submit to me all of your menopause questions. And let me tell you all what, you lit me up. I had so many questions to go through and I submitted every single one of them to Midi Health. All of the doctors from Midi Health, along with the specialists and clinicians, sat down and wrote out to me answers to every single one of your questions. And that is what I'm going to share with you in today's video. So I am so excited to actually have these answers because a lot of your questions, honestly, were things that I wanted to ask myself. I started personally working with the Midi Health menopause specialist back in the spring, I guess it was about 6 months ago. And I did a full video about who is Midi Health, what do they do, and why you should see them if you are in menopause and have questions. I'll link that video down in the description box if you want to go back and see it. But Midi Health specializes in menopause, perimenopause, and all the things that go along with it. That is what they do. You get to see a Midi Health specialist from the comfort of your home. You have a virtual face-to-face appointment with them. That appointment will last for a minimum of 30 minutes, and you have one-on-one time to ask all of your menopause questions, have all of your concerns addressed, and be given answers that are tailored to you. That's one of the reasons that I am a patient of Midi Health. And you don't have to drive to a doctor's office. Everything is virtual. The conversation that you will have with your Midi Health specialist is not rushed. The time is dedicated to you from the comfort from your own home. It's just absolutely fantastic. So now let's get into all of your questions. And when you all submitted the questions to me, a lot of you asked the same exact question, just using different words. So I did go through and kind of consolidate and compile things down, but I promise within this video, you are going to get the answer to your question. I don't know how long this video is going to be. I have a lot to go over, but I urge you, if you are in menopause, perimenopause, and have issues, sit through this video because I'm willing to bet you that I will have an answer that you are looking for. Every time I start a new question, I'm going to put a number in the corner of the screen. So if you listen to the question and it absolutely does not apply to you, you can hit that fast forward button until you see me get to the next question. Because some of the answers from Midi Health are quite long and I want to read them exactly the way they were presented to me because this is true medical advice. I don't want to shortcut it. I don't want to leave out sentences. I don't want to paraphrase. I hope the numbers in the bottom of the screen will help you to find the answers that you're looking for. So first question, the lady says, I'm 51 years old, constantly tired, can no longer take the heat. Sometimes it makes me feel like I'm going to pass out. I'm not on hormone replacement therapy and have been menopausal for over 5 years. Who do I see and what kind of help can they give me? Well, obviously, you book an appointment with Midi Health, but Midi Health says you can absolutely benefit from menopause management. They would need to take some blood tests because you say that the heat is bothering you, but as long as no issues come up, they would absolutely recommend that you start a form of hormone replacement therapy. Why do I need 25 grams of fiber every day, and what are the benefits and best foods with the highest fiber content? And the answer is fiber slows down your gut absorption and helps with blood glucose control and even your cholesterol levels. It also acts acts as a probiotic, which means it gives gut bacteria something to live on and thrive on, and the medical field is increasingly aware of the benefits of gut bacteria. It also will make you feel fuller longer, making you eat less and making you choose more healthy foods. And foods that have a high fiber content are also foods that are a great source of vitamins and minerals. They said it's pretty hard for you to find a food with high fiber that is bad for you, and that is very true. They recommend chia seeds, flax seeds, fruits, veggies, beans, lentils, and nuts. And I want to jump in here and add that since I had my personal consultation with Midi, I have started adding chia seeds to my yogurt every morning. I enjoy a bowl of low carb yogurt with raspberries and then either blueberries or blackberries. I put pecans in it and about 2 teaspoons of chia seeds. All of those berries, pecans, and chia seeds are giving me a ton of fiber in the morning. And honestly, I do intermittent fasting, so I eat this at about 10 or 10:30 in the morning. And there are most days that I don't even think about lunch until 1 or 1:30. Those berries and the yogurt and the nuts and the chia seeds really fill me up. And since I started doing that, I can honestly tell a difference in my food cravings. I'm hungry less, which is a good thing. What can I take to control menopause symptoms that is not estrogen based? That's the key here. This lady says her mother died of breast cancer and she's scared. She has the blues and memory loss. First off, Midi Health says having a family history of breast cancer does not mean that you cannot take estrogen. This is a misconception, and this is one that I hear all over the place, and I'm so glad that they brought this up in their answer to you. This is a misconception. It does mean, however, that you should have high-risk screening and maybe even genetic testing. Remember that in the big World Health trials, estrogen reduced the risk of breast cancer. Midi has a breast cancer risk and cancer menopause specialist that can support you. That being said, there are some women who need non-estrogen fixes, and there are many science-backed ways to address your symptoms, and the solution will vary by the symptom. So, if this is you and you have breast cancer in your family and you're scared to take estrogen, do the testing that Midi will prescribe for you, and then you'll know whether or not you are free and clear to take estrogen or you need an alternative. Fantastic answer. I'm glad that was brought up. So how do you get blood work done if you are doing a virtual visit with Midi? Midi can order blood work and imaging at a facility that is local to you and accepts your insurance. All of the results are sent back to Midi Health, and then you get on a virtual visit with them to get the answers to your test and to discuss where you go from there. Next question. I'm age 51 and going crazy. I'm depressed. I cry a lot. I still get regular but very heavy periods. Is this normal? Midi says it is all too normal, unfortunately. There's a ton of signs on how hormone depletion, especially the estrogen depletion in menopause, creates metabolic stressors that trigger depression and mood swings. The hormone depletion also triggers poor sleep, which so many people don't sleep well due to menopausal changes, and being tired always exasperates your mood. Vaginal atrophy and greater risk for UTI after loss of estrogen. Is this true? And how can you help me? And Midi says, yes, yes, and yes, exclamation point. Vaginal dryness and atrophy can cause pain with sex, but it also causes recurrent UTIs, urinary tract infections. Topical prescriptions and therapies can help you tremendously. And Midi can prescribe a variety of care solutions for vaginal atrophy. To the gal that sent in that question, Midi Health can absolutely help you. You need to give them a call. And Midi Health can absolutely prescribe medications. They can order lab work, and it is all covered by your insurance, including your virtual office visit with them and your prescriptions. It is covered by your insurance. If for some reason you have an insurance that is not covered by Midi Health, and they are in all 50 states, by the way, but if that's you and your insurance is not covered by Midi, you can pay out of pocket for your virtual appointment with them. It is $250. They state that up front for a minimum 30-minute one-on-one virtual call with you. And you will learn so much specialized information because you can ask the things you want to ask. You're not dealing with a doctor who gives you 10 minutes and has to run back out of the room. You have a specialist that is dedicated to you to talk to you and answer all of your questions and address your concerns. This next question is an excellent one. I wear an estrogen patch and I did not know this myself. So let's jump in. The question is, where is the correct place to put your estrogen patch? Just below the panty line, on either side between your hip bone and your belly button. So basically, if you put your fingers where your ovaries are, that is where you should put your estrogen patch. And every time you switch your patch, you should alternate sides from left to right to left to right. I occasionally was putting mine on my hip back here, but since I got their answers, I have stopped doing that. I'm always doing it on the front. And y'all, this next one, I have talked about this so openly on my YouTube channel, and I'm glad somebody asked it. Is there a link between menopause and rising cholesterol? And the answer is absolutely yes. Let's get into it. Menopause changes our metabolism. We have estrogen receptors in our liver where everything is metabolized, and it's associated with higher LDL levels, which is the bad cholesterol. And it's lowering the HDL levels, which is the good cholesterol. That is exactly what happened to me. Hit menopause, my cholesterol, my LDL went through the roof. I had no idea that there was a correlation between the two, menopause and cholesterol, but there absolutely is. And a lot of you all sent in similar questions about menopause and your cholesterol went up. That is exactly what happened to me, and now we have the official answer. Yes, there is a correlation. Why do I still get hot flashes? I'm postmenopause and I'm on hormone replacement therapy. Midi says hormone replacement therapy should significantly reduce your hot flashes and night sweats, but it is not unusual to still occasionally get a flush. A flush is of lower intensity and less frequency. If you're still getting a lot of hot flashes and symptoms, check with your Midi specialist to have your doses assessed, or even check your levels to see if a different formulation or dose is needed for you. You could just simply be on the wrong dose of HRT. They can help you with that. Explain the relationship between menopause and arthritis. It has been proven that estrogen depletion during menopause has been associated with higher blood markers of overall inflammation. Think of estrogen as an anti-inflammatory. The less you have, the more things get inflamed and irritated, including your joints. This next one is fantastic. Estrogen roll-on versus estrogen patch. Explain the pros and cons of each. And I'm going to have to leave my glasses on, ladies, to read this per verbatim. The patch can give you a more consistent level with a slow release of estrogen over time. The cons are the aesthetics of having a patch on. Even though they're small and translucent and you can move them around, as we discussed below your panty line, it can bother some women, and every once in a while your skin can have an adverse reaction to the adhesive on the patch. The pros are it's easy to put on, you don't have to remember to change it every day, and most likely it is covered by your insurance. With the roll-on gel, you have to remember every single day to do it, and you can get some inconsistent levels when you put it on, and the insurance coverage is uncertain. But you don't have to deal with the patch, and there's no adhesive. So really the best option is what works best for you and your lifestyle. For me, I wear an estrogen patch. I change it every Monday and Thursday, and I honestly forget that it's on me. I just stick it on and go. Loss of sleep, insomnia, waking up every few hours. Any tips and suggestions are greatly appreciated and much needed. This also was a very common question. Hormone replacement therapy can help you with your sleep, especially progesterone. Manage your stress. Consider evidence-based supplements like magnesium. Y'all, I've been talking about magnesium. 4 years on this channel. I love it. I take it. The magnesium that I enjoy will be linked in the description box. It's a triple magnesium supplement and absolutely wonderful. Helps me get into a very deep sleep. Back to what I was saying. Supplements like magnesium, ashwagandha, melatonin, etc. Exercising daily increases your serotonin and helps you sleep. Sleep is tough. It's just hard to come by, it seems like, when you get older. But honestly, I work out every day. I go on a walk. I manage my stress levels, and taking that magnesium supplement and being on hormone replacement therapy, I sleep wonderfully. I literally sleep like a baby, almost 8 hours a night. Someone wanted to know if Midi Health treats anything outside of perimenopause and menopause, and their answer is absolutely yes. Those two topics are their bread and butter, but they offer a wide range of specialty visits, from weight loss to PCOS to bone health and so much more. So Midi Health can help you in lots of things. If you are over the age of 40, 45 and you're not getting the information and the specialized attention that you need from your local family doctor, highly recommend booking a visit with Midi Health. Any recommendations for hair loss? I'm having a fair amount of hair thinning. Yes, hormone changes in menopause do influence hair growth and loss. Evidence-based effective interventions can include hormone replacement therapy, stress management, certain types of shampoos, oral minoxidil, and Midi also has a topical spray of minoxidil that will help you as well. So the next lady is age 56, postmenopause. Should she be on some form of HRT and what type? And Midi says, most women will benefit from being on hormone replacement therapy. You should book an appointment with Midi Health to discuss the risk and benefit factors. While 15 to 25% of women don't have hot flashes or night sweats significant enough to feel like they need to be on hormone replacement therapy, there are benefits beyond these symptoms. So all women in menopause should understand the benefits and have some form of discussion to determine if it is right for them. Oh, this was a common question. I had to paraphrase this one, ladies. This is the big question. Bloated belly, weight gain, back fat. Where is it coming from and how do we get rid of it? And I'm going to hold my hand up. I am in this category. Since I have been in menopause, my belly is just boom, and I want to know, how the heck do I get this gone? And I know you do too. Menopause, regardless of your age, will slow down your metabolism. It's associated with weight gain as well as a shift toward weight gain in the mid region, your central section. Midlife and menopause tend to be when a woman's weight peaks and creates a variety of other health risks. It's an important time to lean into your health and your self-care. Midi has a weight management program inclusive of prescription medications, lifestyle changes, supplements, and other aids to help you on your weight management journey. I know that's kind of a broad answer because every woman is going to be a little bit different. Should hormone levels be tested? If so, when and how? So Midi Health says, with classic symptoms of menopause, you do not need to have your hormone levels tested. You can start hormone replacement therapy, which is well within the expert guidelines. For example, a 52-year-old woman with no periods for the past 12 months, that's menopause by definition. So you do not need to have lab work. There is nothing that you need to test to see what your hormone levels are. The answer to that question gets a little bit more twisty when you have a woman that is younger, not within the normal menopause age, someone that's on birth control with an IUD in place, or atypical symptoms like she can't sleep but there are no hot flashes. Labs can definitely help in those situations, and Midi Health can order those for you. I'm age 45. I'm in perimenopause. My doctor prescribed birth control. This is exactly what my local doctor did. Is there a better alternative to control my symptoms? Birth control pills have a combination of estrogen and progesterone, which is a form of hormone replacement therapy in itself. You can still ovulate, you can still get pregnant in this time frame, and birth control pills are a great option if you are also trying to avoid pregnancy. Traditional hormone replacement therapy can also be given, but that does not help you avoid pregnancy. So, The way I understand this, if you don't like the option of taking birth control, you can still get a form of HRT. Book an appointment with Midi Health. They will help you with that. And then this is a question from one of my friends. Lindy, here is your answer. She has horrible aches in the back of her knees and joints and in her hands. She has a heart condition called cardiomyopathy. What can she take? Lindy, Midi Health says that you are likely a candidate for hormone replacement therapy. Cardiomyopathy does not exclude this possibility for you. It can help lower your inflammation and sometimes help with joint aches, particularly if they've come on since menopause. Lindy, I know you have a special situation and I hope that answer is helpful. Absolutely book an appointment with Midi Health, make that virtual visit, and they will get you squared away. Our uncommon symptoms related to menopause, such as back pain, ear pain, the feeling of having a fever all the time. There are so many uncommon symptoms to menopause. There are tons of articles and evidence to support itchy ears, dental and tooth pain. Women do experience all kinds of symptoms during menopause, and some of them are unusual. That's why Midi Health is the place for you. During your one-on-one consultation, they will listen to your unique experience and symptoms and tailor a solution just for you. It is not going to be a one-size-fits-all solution. So I truly feel like that this question and answer session with Midi Health, sitting down and addressing your menopause and perimenopause questions, is helpful to the ladies that submitted the questions and all of the other women who are searching for answers on YouTube. I know that Midi Health has absolutely helped me in my menopause struggles. It's simple to book an appointment. Go to their website. There is a very extensive questionnaire you will go through. Give them your medical history, answer very detailed and intimate questions about your health, your sexual health, your well-being, your feeling, your mental health, so that when you meet with your Midi specialist, she is fully prepared. She's read over your background. She knows your medical history, and you can have a very private one-on-one conversation with her to address all of your menopause symptoms, and they will get you straightened out. They will head you down the correct path to feeling your best. So thank you so much, Midi Health, for partnering with me in this video. It has been a joy. I'll see you all in the next one.